And talking to that, what are some of the key actuarial skills that you have used throughout your career? I think often students sort of say to me, we're learning all these things, and how much of this are we actually going to use, And can you maybe speak to that, given that you've also worked in many roles?
Yeah, that's an interesting question. I mean, I think, because I get a lot of questions internally now in the group from youngsters asking about, what should they be focusing on, and what skills should they be developing. And it's very hard. There's no one right answer in my view there. Like, you really have got to figure out what you enjoy, what you are willing to put time and effort into, how competitive you want to be, whether you want to be a sort of deep technical person, whether you want to be a generalist. And those answers can also change over time. So I don't think there's one path there for anyone. I think, it's an adventure, and you must embrace that adventure. Most mistakes, quote unquote, are not irreversible.
Yes.
And, we'll try something, and if you don't like it, it doesn't work, you can reverse out of it and try something else. At some point, it becomes more difficult to change because you develop a network and you develop a personal reputation, professional reputation, and you become an expert in something. And then it's just evolving that over time. So even Christoph and I have this discussion, like, do you become like a super specialist?
Yeah.
And, which in some respects can be boring because you're doing the same thing all the time because you're the best at that. And you have to know that that's what you want out of your career. Or do you become a generalist where, every day is a new set of problems?
Yeah.
Let me answer the question a different way. I can tell you there's a lot of things they don't teach you in actuarial school, which is, has been hard lessons for me, particularly as we've been growing as an organization. And that is, we used to call them softer skills, but I would say the essential skills.
Yes.
Dealing with people, dealing with conflicts, what does it take to lead a team, leadership in general, vision, all of these kind of things. Now, you get exposed to that kind of stuff at corporates, I suppose. You wouldn't expect a grad to come out with all of those kind of skills.
Visionary.
Yeah. But I think exposing them, like, just to those concepts, and just, explaining to them, you're going to go and work in a team. What does that mean?
Yeah.
And how to function well in a team, and how should you be thinking about career? How should you be thinking about exams versus career? What are the kind of trade-offs you're going to have to make in your sort of first 5 years? I think it's for students who do well to come out equipped with those kind of skills. The rest of the stuff is more just a gripe that, it's hard when you when you haven't walked a sort of big corporate path with all of these courses already. So we're starting now. We're rolling out courses internally for the middle managers to learn those skills for the next generation,
Yeah.
But there's a lot you have to figure out along the way otherwise.
There's also on the ground skills, I guess. It's difficult to teach someone people management in like a theoretical course, right?
Yeah.
So it is something that I guess you get exposure to over time.
Yeah. But even from the other side, like a one-day session on basic industrial relations, labor law. People are going into the workforce. They don't know what rights are. They don't know how to read an employment contract.
No, exactly. Understand their pay slip.
Yeah.
Like basic stuff. Yeah, I agree with you. There's many different questions that I want to ask you still, but one thing I wanted to ask is that in sort of talking through your career trajectory, you spoke that you had worked in sort of corporate and obviously consultancy, and what were the different draws of each of those? Like, what was it that you liked about corporate, and then why did you leave corporate and then go more into the consulting space, and what was the difference in the work you were doing?
So it was like different phases, if you like, for me. So when I'll ignore the pensions. That was a bit of a waste. I think first year of work in general is a waste. You don't know what you're doing.
Yeah, you just at odds with everything.
It's a bigger leap than going from high school to varsity.
Yeah, it's true.
Yeah, So, for a long while we didn't even hire graduates because of that. Because it's a big investment on the firm's part without much to show for it in the first
study
year.
leave and then writing exams. Yeah.
But so after a few years. So we've been running a successful grad program now for the past sort of 5 years or so. We recruit 3 or 4 a year, which has been fantastic for us, fueling our growth. Ignoring the pensions, my first 2 years in healthcare at Liberty were very. My exposure was very broad. So they had a medical scheme at the time, and it was a very competitive marketplace. At that time, Discovery were competing with Fed Health for like the number one spot.
Okay.
Different strategies, just completely different environment. And Liberty were competitive, small and growing, like the big sort of blue brand behind it. Actually speaking, it was just my boss and I, so it was a sort of small outfit, and so I got to know like the width of the business.
Yeah.
But you had to do a little bit of everything.
Yes.
And then a year into that, unfortunately, she fell ill.
Your wife?
Yes, my boss. And so there I was, like, I had more experience than all the other actuarial people in Liberty in terms of medical scheme.
Yes.
And so I had to go through this exercise of pricing and benefit design.
Oh, my word.
Fortunately, everything was well documented from the year before. So, that is like...
Benefits of documentation.
Yeah. Benefits of documentation. But I think if I knew then what I know now, I didn't know then, I probably wouldn't. I would have chickened out.
Yeah.
So
Yeah.
I was sort of young and enthusiastic. So that was a big learning step for me.
Sure.
That was probably like one of the key sort of defining moments for me. And then I just, sort of 6 months, 12 months after that, realized it's all good and well to be thrust into a senior position 2 years into your career, but I had no one to learn from.
Yes, and that mentoring aspect.
And I was very nervous about that, and so at that time, an opportunity came up at Discovery, which was obviously in a different position altogether. They needed someone with some experience. We didn't need hand-holding, but there was just an extraordinary depth of senior people to learn from them,
yes.
Actuarial in particular. And so that's why I say I went there for my real sort of formative years, if you like a deep dive into sort of the deep expertise in healthcare actuarial work. I mean, that was an amazing time in the early 2000s.
And what was the breadth of that work? Was it mainly pricing?
So really little pricing, actually. So much more on the risk management side.
Okay.
The risk management side and the provider engagement side. So hospitals, doctors, etc. So I pioneered some interesting work there on the provider side.
Okay.
And I mean, it was, a data-rich environment. You probably, at the time, you had people who probably still have, even though many of them have moved on, the best insights into health systems,
yes.
South African health system, etc. I mean, really learned from some amazing people. I spent a bit of time on the vitality side as well, so sort of got a fairly good understanding of how that sort of side of things work, incentives, behaviour, loyalty, wellness programs, etc. But yeah, the bulk of my time, say about 2/3, was on the risk management side.
Okay.
Just how to think about, the ever-increasing cost of healthcare and what to do about it. And then, just sort of started to get restless.
How long were you at Discovery?
6 years.
Okay.
Yeah, which used to seem like a long time until now I've been out of there so long that it actually seems quite short. I just got restless and wanted to, sort of spread my wings and try my own thing, which also, if I knew then what I know now, I didn't know then, was like really stupid. But yeah, I mean, I left, consulted back to them a little bit.
Okay.
Started to pick up some other clients. At that time, most of the actuarial work outside of the managed care organizations was the traditional medical scheme pricing, RBNO,
yes.
etc. And there wasn't really much in terms of the kind of risk management work that I was doing. There's lots of different names: managed care, analytics, strategic managed care,
yes.
all of those kind of things. And there wasn't much depth of expertise in that area in the market. And so that looked like there was a lot of opportunity. So I picked up, I did some work for the regulator for a while. At that time, Anna McLeod had departed and they were looking for some actuarial input there. So I did some work for them. Picked up a big hospital group as a client. Moved to Cape Town. On the back of picking up some client contracts. Also not, the smartest move commercially, but lifestyle-wise, we haven't looked back. And then, that's, just took each day as it comes. I was on my own for about, as I say, about 3 or 4 years. And there you have to do everything, marketing. I mean, I worked ridiculously hard.
I'm sure.
I mean, you've got to, be at all the conferences. You've got to be meeting people.
Because you don't have the safety net, right? Of a guaranteed salary.
If you don't work, you don't invoice, you don't get paid.
Yeah.
And I think that's the work ethic that breeds, I think, is definitely something that professionals in general don't understand.
Yeah. Yeah.
Even that we've grown now, we have to remind consultants that there's a very short line between making the proposal, getting the client, doing the work, invoicing, and getting paid your salary. If you're working at a big insurer, you're completely divorced from that.
Yeah. You're just absorbed into the mechanism.
You do your work
business.
or not, you're going to get your salary and a performance review. Every now and then there'll be recruiting or downsizing. You're just like
kind of ride that wave. Yeah.
But when you're working on your own as a consultant, it's a whole other thing. You really are, and I love that. But yeah, I mean, it was 12-hour days, 6 days a week for a while.
Sure.
Yeah.
Sure.
But it was fun. I mean, I couldn't do it now.
Yes, period of your life.
At the time, it was good, and sort of building up that professional, personal reputation. And then we morphed into what it is now. I mean, I made a good enough living, but it's also hard to scale. You can't scale your own time.
Yeah, exactly, because you have a finite resource there.
It became necessary to be part of something bigger that could grow. If that's what you want. It's not for everybody. Some people are fine not scaling.
Yeah.
There's a point you reach in your career where you begin to plateau. Whether you're a professional working in a corporate or even as a consultant, and you either decide to be happy and content with that or not.
Yeah,
and that's a very individual choice.
Yeah. And this is maybe a question I should have asked earlier, but why healthcare? What is it that drew you to that?
I think it's really, it's not. I mean, there's a very strong social element to it, which I really like. It's not as abstract as some of the other areas.
I
wasn't that particularly interested in investments.
Yeah, I was the same.
Definitely not pensions. I mean, although now the social elements of all of those areas actually are more interesting to me. But at the time, I couldn't get excited about those things. Whereas healthcare was immediately exciting. It's a different question every day. It's an incredibly wicked, multifaceted problem. You deal with not only technical, data-oriented issues. You could never run out of ideas for technical work if that's what you're interested in. You could model things. Yeah,
there's a wealth of data.
There's a wealth of data. There are infinitely many models you could contrive to think about. It's an ever-changing landscape.
And there will always be an issue. It's not like it's going away.
Exactly, there'll always be an issue. There's a lot of contention in the environment, so it's an industry. It's not a purely financial industry. There's a whole industry. Private healthcare in South Africa call it 250 billion rand industry.
Sure.
With hospitals and doctors and pharmaceuticals and devices and equipment, and so there's this whole sort of commercial ecosystem underneath, which is incredibly complex and interwoven with incentives, some of them perverse incentives, with moral hazard, with all of the problems associated with actuarial sort of thinking exist there. General insurance, you could say, similar, but I think the management tools are blunter.
And it's less emotional, I think, in many ways, because it's not necessarily your life that you're talking about.
Yeah, I think there's a strong social, you feel like you make a real difference. Like if you make it, I don't know, sort of marginalize some of the importance of the other industries, but if you make a difference in life insurance or general insurance, what does that mean? It means people pay a less premium if you can come up with something clever.
Yeah.
Like a new product, better underwriting.
Yes.
You can
better risk management or whatever. Yeah.
If you make a difference in healthcare, come up with a clever way to align incentives or incorporate quality measurement into, the way that providers are paid, and that changes behaviour and improves health outcomes. So that's like a whole other level of effect and impact on people's lives that has appeal.
I think something that you spoke about, so you said